Hello, Dr. Anna Bene here. This is a short video from CamDocUK advising on how to reduce the risk of contracting COVID-19 infection and staying safe. In the UK, there is a disproportionate impact of this infection on the Black, Asian, minority ethnic group. Its death rate is more than 2 times higher in this group than in whites. Causes are multifactorial and include underlying health conditions, nutrition, lifestyle, and the fact that many of us are key workers, so more exposed. Please listen carefully to the information and advice in this clip.
Here are a few tips to help boost your immune system. Food. I suggest cutting out all processed foods which are normally high in sugars and increase consumption of leafy green vegetables as well as cruciferous vegetables like kale, cabbages, and broccoli, which contain powerful chemicals for liver detox. Increase consumption of berries, which contain powerful polyphenols, health benefiting chemicals. Vitamin C, 1,000 to 2,000 milligrams a day, a great immune booster and antioxidant. Minerals, zinc and selenium, powerful antioxidants as well as immune boosters. I also suggest daily exercise if possible. Thank you.
Vitamin D is in majority produced by the skin following exposure to sun rays. African, Caribbean and minority ethnic groups are at high risk of developing vitamin D deficiency or insufficiency. This is because of the melanin contained in our skin, which reduces the absorption of those sun rays used to produce the vitamin D. A study showed that people suffering from vitamin D deficiency are at higher risk of developing a condition called acute respiratory distress syndrome, which is a complication seen in most severe cases of COVID-19. So, to stay healthy and fight against coronavirus, we recommend you supplement yourself in vitamin D.
It is, of course, worrying to be pregnant during a pandemic. But what we do know is that your risk of catching the virus isn't increased because you're pregnant, but you might be at a more heightened risk of severe illness. This in particular, if you are of BAME origin, if you are obese, if you do smoke, have high blood pressure or diabetes. The transmission to the unborn child appear to be minimal, and certainly there's no reported case of congenital abnormalities linked to that. Most pregnancies will evolve with no problem whatsoever, but it is essential, should you have any concern about your pregnancy, to contact your midwife and or local hospital. Your employer needs to know that you are pregnant, because from your 28th week gestation, you must not be in a position where social distancing cannot be observed.
The current advice from the Royal College of Obstetrics and Gynecology is that you can continue to breastfeed. To keep your baby safe, always wash your hands before touching your baby, the feeding bottles, or the breast pump. Always thoroughly sterilize all feeding equipment. Regularly wipe and disinfect all surfaces around the house. Do not cough or sneeze on your baby. If you develop any symptoms of coronavirus, wear a mask while feeding or handling your baby. Seek medical help early and follow the instructions. Likewise, if you have any concerns about the well-being of your baby, contact your healthcare practitioner or ring 111. Stay safe.
Now, we know that kids can also have coronavirus, even though they tend to have it less often than adults and tend to have less serious illness. Kids with coronavirus can have vague symptoms such as sickness, tummy pain, diarrhea, skin changes, and sometimes life-threatening inflammation of their internal organs. Be a good role model to your kids by following government-enforced guidelines. Encourage kids to have plenty of outdoor activities and ensure that they stay socially connected. If you think your kids may have coronavirus, keep calm, reassure them, encourage them to drink plenty of fluids, have plenty of rest, and if you get worried, speak to your GP, ring emergency numbers, and follow the advice. Very importantly, do not wear face masks in children under 2 years old, and if you wear face masks in older children, ensure they always remain supervised.
Older people are at an increased risk of severe illness and death from COVID-19. This is due to a decreased immune function, multimorbidity, and frailty. And they are more likely to present with non-specific symptoms like falls, confusion, poor mobility, and social withdrawal. This group represents a vulnerable population who should be shielded from COVID-19. However, there is also a great need to remain active to prevent deconditioning, which also has a worse health outcome. If space indoor is limited for sufficient activities, exercises should be done outdoors following strict government guidelines. So, protect yourself more, and family members should seek medical attention even when they present with no specific symptoms.
Diabetes and hypertension are both independent risk factors for poor outcome from a coronavirus infection. We know that these conditions are unfortunately very common in our community. If you have been diagnosed with either, it is vitally important that they are well controlled. This can be achieved by attending your reviews with your GP and making sure that you take any prescribed medication every day. A lot of people are also walking around with undiagnosed hypertension and diabetes. It is vital that at age 40, you attend your NHS health check at your GP. You can also see your GP to get checked if you're concerned that you may be suffering from either condition, especially if there is a family history.
Steam inhalation cannot prevent or cure an infection with the coronavirus. Now, using substances such as eucalyptus and menthol can be soothing and can make you feel better if you have a blocked nose or cold as part of steam inhalation. Likewise, using herbal remedies will not cure the coronavirus and cannot prevent an infection with the coronavirus. In fact, herbal remedies can be quite detrimental to your health, as in most instances, the contents of a herbal remedy is not known and can be quite fatal, can lead to organ failures such as kidney failure.
As a key worker, you are exposed to people who may or may not have coronavirus. You need to make every attempt to stay safe at all times. Consider everyone as potentially infected. Make sure you have adequate protective equipment. It is best to change into workwear when you get to work and wash the workwear separately at temperatures of at least 60 degrees centigrade. Better if this washing can be processed through dedicated laundry service. Try not to carry the virus home. Rub down when you get home, at least gel your hands and change your clothing.
It can be quite complex to social distance, especially in markets where there are many people at all times. So you should definitely wear a mask. Avoid crowded shops and crowded open spaces. Do not visit the market regularly and only if necessary. For example, once weekly or twice monthly. Remember to use hand sanitizer regularly whilst in the market. Where possible, pay with a contactless card and wash your hand as soon as you get home. Thank you.